Good morning, everybody, and welcome to our first Security Health Plan Academy of the year. For those new to the Health Plan and webinar series, we're excited you're here. Security Health Plan Academy is designed to provide you with information relevant to your health, wellness, and healthcare plan on the third Thursday of each month. We're starting off 2025 with a bang, discussing the distinctions between Welcome to Medicare exams, annual wellness visits, and annual physicals. Our goal today is to help you determine which exams are right for you and how they can benefit your health. We'll touch on vaccinations, recommended cancer screenings, and various screenings available for chronic conditions. We've secured a true expert here at Security Health Plan to present on today's topic. Please join me in welcoming Security Health Plan Chief Medical Officer, Dr. Renee Smith. Dr. Smith earned her medical degree from the Medical College of Wisconsin and completed her family medicine residency with Waukesha Family Medicine Residency. She obtained her Master of Business Administration from the University of Wisconsin-Oshkosh. She continues to practice medicine part-time in addition to performing her administrative duties. We've got a lot to unpack today, so without further ado, let's get started on today's presentation, Uncovering Your Path to Better Health.
Thank you, Ashley, for that introduction. And I look forward to spending some time with you all to talk about annual wellness exams. And very pertinent that as we're entering into the new year, this is exactly what we're talking about. So the timing couldn't be perfect. As Ashley indicated today, my goal is for you to learn a little bit about the difference between a Welcome to Medicare examination, an annual wellness visit, an annual physical, the importance of staying current on vaccinations, screenings for both cancer as well as chronic condition. And again, throughout the presentation, you're going to hear the theme of the importance of preventive care in ensuring that we're reducing any risk to your health as you age. So welcome to Medicare. We'll jump right in. This is your initial preventive visit as you enter into a Medicare enrollment and a Medicare program. It promotes good health through disease prevention, through disease detection. This is a once in a lifetime visit, and it must be done within the first 12 months. The goal is to establish a baseline of your overall health. And we're going to talk a little bit about kind of the routine of ensuring that you have a plan of care going forward. This sort of sets the stage for that as you enter into Medicare services. So moving on is now an annual wellness. So you've had your Welcome to Medicare, a lot of good conversation about where you are on your health journey and what your needs are. This conversation gets to translate then into an annual wellness visit. This is now a yearly appointment. It does again focus on preventive care. You can see the components listed below. Those are just a few of the components that you might experience as you enter into your wellness visit. The idea is to assess your health, understand where there might be risks, and then put a plan in place to mitigate those risks. And we're going to talk about components of mitigating those risks a little bit later. What you might notice on this slide is no full physical exam is necessary for this visit. So you might be noticing as you come in for your wellness visits in the past, you might, have gotten fully undressed and had a full head to toe exam. That might not be the case going forward. There might be no physical exam at all or a limited physical exam based on the conversation that you have with your provider. Again, the outcome of these visits is to really create that personalized plan for the remainder of the year of what services you need to get completed, what help you might need to mitigate some of your risks. There's functional screening, there's fall risk screening, conversations about vaccination needs, and again, cancer and chronic disease screenings, which we're going to focus on later in the presentation. When we talk about an annual physical exam, certainly it's in the title. This will be a period of time where you go into the physician's office, and this might be where you get undressed, where you do a full head to toe examination. You might have other blood work and other tests done as well. The idea behind all of these visits is just to ensure we understand where you're at on your health journey. We want you to live your happiest, healthiest life, and we want to put a plan in place to ensure that that occurs. So most importantly about each of these visits is that you see your primary care doctor at a minimum on an annual basis to put that plan together. So in conclusion, there's a lot of opportunity to ensure you're on the right path to health. Annual wellness visits is a component of ensuring that happens. That's a great place for you to put a plan in place with your physician or clinician on what you're going to do for the remainder of the year to remain healthy. You can see the components again listed here that might be part of that evaluation and that visit. And again, the goal is all about that healthy plan for the remainder of the year. I'm going to get into now some of the details of how we do that. How do we try to mitigate risks or concerns? As we age, we know risks increase. And so we want to make sure that we can do anything possible to reduce that. The first thing we'll talk about, as per the agenda, is vaccinations. Vaccinations are a way of protecting you against harmful disease before you encounter them. The idea is to use your immune system to boost it so that your risk of the disease is lessened. You can see a list of vaccinations below that your physician is or clinician is likely going to talk to you about. Some of them protect against certain viruses, others are bacteria. Some of them you need to have annual vaccinations. Some of them are a once in a lifetime vaccination. So the plan that your physician and you put together will help you get on track to ensuring you're protected against these illnesses. We're going to enter into discussion now about screening. We're going to talk a little bit about cancer screening. We're going to talk about chronic condition screening. Really, the idea of screening is all about early detection. So you're going to hear that a lot from me as we move forward. You know, the plan is as you detect health conditions or problems earlier, you can address them and live longer, healthier, and more satisfying lives. Preventive services, as we're talking about, are a way to get to that early detection. And again, we all know this, as we age, our risk in our health goes up. And so we want to work to reduce that risk as we all age. Again, importance of cancer screening. I can't emphasize enough the importance of screening for early detection. When we detect things early, the treatment paths are different and we can get to cure. So again, want to make sure that I emphasize the importance of routine cancer screening to get to that early detection. We're going to go into just a few of the cancer screening modalities. You're going to hear a common theme now that's going to be about, well, this is the standard if you have, you know, sort of a normal history, but these things may adjust. And it's important to have these conversations with your physician. So as it relates to breast cancer screening, it is recommended to start at the age of 40, and you can consider discontinuing at the age of 75. These age ranges may change based on family history or risk, life expectancy, etc. So again, it's important to have this conversation with your physician or clinician. Annual screening mammograms is the routine way for breast cancer screening to be completed. But again, depending on risk, you might have different imaging modality that's introduced, such as an MRI. Lung cancer screening is done through an annual low-dose CT scan, and the risks for lung cancer are listed below. So if you recognize yourself in these risk factors, please be sure to talk to your physician about getting lung cancer screening completed. And the last cancer screening we're going to talk about today is colorectal cancer screening. Again, the age range is now from 45 to 75, but that might, again, flex based on personal history. And so again, important to have those conversations. There are 4 ways that you can consider screening for colorectal cancer. I'm going to walk through these, but just so you know, if there's any abnormality, they all end in a colonoscopy. So colonoscopy has been for a long time now considered the gold standard screening. But just to walk through all of the screenings, we have stool samples. You can check your stool for blood or for certain antigens. That is a concern then that there might be something going on in the colon and need to be evaluated. If either blood or those antigens show up in the stool sample, it is going to be recommended that you proceed with a colonoscopy. So you need to understand that that test, if it becomes abnormal, will lead to further evaluation. Flexible sigmoidoscopy is another way you can be screened for colorectal cancer screening. It is also an invasive procedure where it goes up into the sigmoid part of the colon to evaluate for polyps. The challenges with the flexible sigmoidoscopy is it does only evaluate a portion of the colon, and there is no way to affect what is found there. So no biopsies or sampling will be done if anything is found in the colon. Therefore, if you have a sigmoidoscopy and something is found, you will have to go on to have the full colon evaluated and to have, the proper biopsies or studies done from that. You can see that you can do one of those every 5 years as a screening protocol. Colonoscopy, as I already talked about, is a gold standard. And it can be done every 10 years as long as there's nothing found. If anything is found in the colonoscopy, your physician will talk to you about the appropriate routine screening thereafter. And then lastly is an imaging study, a CT colonography. This is done every 5 years. You can do this as well if any abnormalities are seen on that imaging. I think it's clear now you'll have a colonoscopy. So again, a lot of different ways you can consider getting screened for colorectal cancer screening or colorectal cancer. The importance is you talk to your physician about which one you would prefer and then what the next steps would be. We're going to move on now to some chronic conditions that there are screenings for. The first one is related to osteoporosis. Osteoporosis is a disease that's characterized by weak or brittle bones. This increases your risk for fracture. And so we want to make sure we know if there's any concern for fracture, there are treatments that can occur to lessen that risk. The bone density scan is the modality for screening that occurs. This will allow and give a calculation to the doctor of your risk for fracture. It is recommended that women over the age of 65 and men after the age of 70 should have a bone density scan every other year. This may be adjusted again based on risk factors. In addition, if a woman over the age of 65 has had a fracture, it is really important to get a bone density scan within 6 months of that incident to check on the status of your bones and your risk for future fractures. Cardiovascular screening has a couple components to it. So the first one we're going to talk about here is related to cholesterol, and then we'll go on to talk about blood pressure. High cholesterol is a significant risk factor for cardiovascular disease. And when we talk about cardiovascular disease, that includes heart disease, that includes your risk for stroke, and that also includes risk for peripheral vascular disease. Cholesterol screening is done with a blood test. We usually call it a lipid panel, and it measures the amount of cholesterol or triglycerides in your blood. It is recommended to start screening after the age of 40 and can go through 75. This will be dependent again on risk. If there are elevations in your cholesterol level on your blood test, your physician is for sure going to talk to you about dietary modifications, making sure you're living that healthiest life, that you're getting a good diet, that you're exercising to try to improve that. But in addition, you might get medication to help control that. It's important to stay compliant with that medication so that the cholesterol stays controlled and it reduces your risk for cardiovascular disease. Blood pressure screening is the other component of cardiovascular screening. High blood pressure or hypertension puts you at increased risk for cardiovascular disease as well. The definition of high blood pressure is having a blood pressure reading greater than 130/80 on 2 separate occasions. So while you might have an elevated reading on one time, your physician might ask you to come back to get a second reading to ensure that it remains elevated. Again, I would anticipate that your physician or clinician is going to talk to you about diet and exercise to help control your high blood pressure if you get a diagnosis. They're likely going to talk to you about medications, and I can't emphasize enough the importance of, compliance with medications, again, to control blood pressure and reduce risk. But they might also talk to you about taking your blood pressure at home. We know that many times the blood pressure in the office, as we see you, is a little bit elevated. But at home, in a more comfortable setting, it might be lower. So if your physician asks you to take your blood pressure at home, know that Security Health Plan has over-the-counter benefits that would allow for you to get a home blood pressure monitor for free. Diabetes screening is also recommended. We do a blood glucose level, and it is recommended for anyone who is overweight or obese and every 3 years. I'm going to switch a little bit here to say now, if you have diabetes, there are certain things that are recommended and certain screening modalities that are recommended for someone who has diabetes already. The first one is just to ensure that your blood sugars are under control. So the hemoglobin A1C is a way for that to be evaluated, and you'll have this likely a minimum of twice a year, but maybe more depending on what's happening with your blood sugars. There are complications that occur when someone has diabetes. Those complications can occur to your kidneys, to your vision and your eyes, and to your nerves, which can cause neuropathy or abnormalities in your ability to sense pain or have sensation in your feet and hands. And for those reasons, it's recommended that annually you have your kidneys evaluated through both blood and urine tests. Annually, you have your eyes dilated and have a good eye exam. And annually, you have a foot exam where the clinician evaluates every aspect of your foot as well as does a sensory test. So know that those are components of now screening when you have a diagnosis of diabetes. We've talked about a lot today. There's a lot to learn about an annual wellness visit. Know that the idea of an annual wellness visit is to create that personalized preventive plan so that we're reducing your risk in health and allowing you to live the best life you can. Again, here are many components that you might realize as part of your annual exam. The most important, again, is to know that seeing your physician on an annual basis, getting that personalized plan is the most important thing you can do for your health.